So we are at part two of of the testimony about Jeff and his tumor and 2020 and our life and the many miracles that God did for us during that year. I thought I'd break it down into little sections. Like I said in part one, I thought I'd break it down in little sections because it's easier. You can listen to a few minutes at a time, and when it gets too long, you miss part of it. And I didn't want anyone to miss any of the miracles that we know of right now. And I'm sure that in the future we'll even know of more miracles that we look back and see that God did during this time period. But I didn't want anyone to miss any of those miracles. So I broke it down into small segments. I'm posting it on Facebook and on my new YouTube channel called But God. And I hope to be able to post in the future a lot of testimonies of our family and other families about the miracles that the Lord's performed for us. And I have a whole video about 2 or 3 minute presentation about why I started the YouTube channel. So you'll have to go back and watch that. But I think it's very important that we tell what God's done for us. So the biopsy was done. That's where we left off the last time. We knew we had a tumor. We didn't know what kind it was. We didn't know if it was cancer or not cancer. So the biopsy was done, and it took a while to get the biopsy back. And when we did, it came back and said that it was a desmoid tumor. Now, desmoid tumors are rare, very rare. Less than 3% of all soft tissue tumors are desmoid tumors. Only about 1,000 in the whole United States a year. And a lot of those are just like, they just grow in your arm or somewhere that it doesn't matter. They may remove them, they may not remove them. They're non-cancerous. So a non-cancerous tumor means that it doesn't spread to other parts of your body. So, not that big a deal normally, except that this tumor grows little arms and it attaches to things around it. So when you have an abdominal desmoid tumor, it attaches to your organs, whatever it's around, and you don't know it until it's too late usually. There's approximately 100 people a year that have an abdominal desmoid tumor. 50 of them die before they know what they had. 50 of them. It's a lot. And so anyway, that's what makes the fact that we found this one within the first few weeks. And that's what the first video is about, how we found this. Within the first few weeks of being able to see it on CT, God had showed us this tumor. And I know that that was a miracle, because if we didn't know it, Jeff would have been dead. And that'll be in the next video. But anyway, we could see it. We knew it was there. We knew it was a desmoid tumor. Jeff called a surgeon friend of his that was in Northwest Arkansas, and he said, "Hey," he said, I need to get this out." And the surgeon looked at the stuff, and he said, "Yeah, okay, let me try." He said, "I'll go in laparoscopically, see if I can remove it, if I can find it, remove it, be done with it, and we'll just go from there." So we went up there, and in our minds, we really thought that we would just have this little laparoscopic surgery, that we'd take it out, it'd be done with, and that God had showed us this tumor so early because so we could do this, so we could just take it out and be done with it, right? We didn't have to go through a bunch of stuff. And surgery that was supposed to take about 3 or 4 hours, he comes back down the hall in less than an hour. And when I see him coming down the hall, I know something's not right. And he sits down and he says, "Tammy, I can do it." He said, "This is attached in some strange places. I couldn't even see underneath it to tell you exactly where it was attached." But he said, "I don't think I could remove it without removing his whole stomach. You can live without a stomach, but I don't want to do that to him and him not know it ahead of time." And he said, "That's a whole different surgery than what I had planned today." And he said, "I really feel like that you need to go see an oncologist surgeon that specializes in abdominal surgeries," which is somebody that removes cancerous tumors, but desmoids they treat like cancer, even though it's not, because it will destroy the organs that it's around. So we immediately Jeff started doing research. He's the king of research. So he started doing research, and he found the Desmoid Tumor Foundation in America, and they recommended 2 doctors. One of them was in New York, and because of the pandemic, his office was completely closed. They weren't seeing patients at all. And the other one was in Ohio. He was the president of the Desmoid Tumor Foundation, and they did agree to see us, so we flew to Ohio in July the 15th. And when we got there, we thought we were going to talk to them about our options of surgeries without taking out his stomach. And so when we get there, they've got all the scans and stuff, and they had ordered a couple more that we brought with us that since the previous surgery that we had had, and they start going over everything, and they're looking at it, and we're looking at it with them, and they said, we really feel like that this is connected to the mesentery, and possibly it's just right there next to the main artery that supplies blood to the bowels, and we don't feel like that you could make it through surgery. We feel like you'd die on the table. So we're sitting there listening to this, and in our minds, we're thinking, okay, we were trying to find somebody who could do something that would save his stomach, and now they're telling us that we can't do the surgery. There was 3 surgeons there that day that were in on this, and they all agreed. And these were world-renowned surgeons that had done multiple surgeries successfully, and they refused. And so, when God knows what you need when you need it, and the steps of a righteous man are ordered of God, and God knew what we were going to face that day. Jeff's brother lives about 2 hours from where we were in Ohio, and he had already said, hey, we're coming down, we're getting a room, and when y'all get out of the doctor's office, we're going to take you out to eat, we're going to have a good night. God knew that Jeff was going to need his brother that night. They said, tomorrow morning we want you to stay, and we want you to see an oncologist here. We're going to start you on a chemo that has a 30% chance of stopping a desmoid tumor from growing. If that doesn't work, then the next round of chemo is a high potency chemo. And when you go on that chemo, you'll be too sick to work. Some people don't even believe that it's worth being on that chemo to save your life. It's so bad. Unless we know that we're saving your life and that we're giving you years, it's not even something you'd want to talk about doing. And this is what we believe is your only option. So now we've got 4 surgeons telling us that they can't do surgery. 4 great surgeons telling us that they can't do it. And we're going to have to try to see if this chemo works. He was very down that night. And you have faith. You do. And people all across the United States that we didn't even know were praying for him. But you still have those up and down emotional times. And Jeff needed his brother that night. And God knew that. He knew that way before we even knew it. And he already had it planned. By the time we got out of the doctor's office, his brother was almost there. And it was just a blessing from God that he was there that night with us, him and his wife. We come back home, we start the chemo, and at first it doesn't work. We thought it was, and then 10 days into it, he starts getting really sick. His labs go crazy, his liver's going crazy. He has to stop. He has to stop the chemo. The 30% chance of life, he has to stop. So he stopped. And we waited for a couple of weeks. waited till everything went back to normal. Then we restarted that chemo with different amounts, just a different way of taking it, and prayed that it would work. After about 30 days of being on it, he was able to tolerate it that time, and after about 30 days of being on it, we did a scan, and the scan appeared to have stopped the growth of the tumor. That was good news. What it meant, though, was that we would always have to be on that chemo, could never stop it, and that every 30 to 60 days every 3 to 6 months for the rest of his life, he would have to be scanned. And you would never know if that tumor started growing again, because desmoid tumors stop growing and start growing for no apparent reason. They don't have enough research on them. They don't know why. And just stop and start. And you would never know if you did a scan and the next day that tumor started growing again, and before your next scan you could be dead. Because where they believe this tumor was attached to the mesentery of the stomach is where all of the arteries and veins are. The mesentery is like a piece of saran wrap. Once you push your thumb through it, once you make it not the right shape, it doesn't go back to its normal shape. It's too thin to sew. You can't sew it. You can't replace it. You can't transplant it. You can't mess with it. And that's where they believe that the tumor was attached. And it was a centimeter, they thought, from the main artery with the main blood flow to the bowels. Once it ate through to that artery, and the tumor grew just slightly less than a centimeter a month at the time that it was growing. Once it had eaten through to the bowel, he would bleed to death before there would be anything that anyone could do about it. So we stayed on the medicine and we waited. And during that time period while we were waiting, Jeff just kept saying, I've got to have surgery. I've got to get this removed. Somehow I've got to have this removed. We have to find somebody that will remove this. Well, our oncologist, who we had had for 20 years, we loved the man, he was a great doctor, retired right in the middle of all this. We didn't even know he was planning on retiring, okay? He retires. We get sent over to another oncologist, which we asked for a certain one, and he agreed to take Jeff, even though he wasn't taking new patients. Just professional courtesy for doctor to doctor. He agreed to go ahead and take Jeff. So we felt very blessed. This man was a great doctor and a good Christian. We felt very blessed that we were able to have him. And so Jeff goes to the point where he said, I feel like I need this removed. I just feel like I need this removed. And I've talked to Ohio. After we came back, we called them back. We talked to them. We had phone calls, phone visits with them, and they were just not going to do it. They were not going to take the risk that he was going to die on the table. He's like, look, if this thing grows, I'm dead, It can't be worse. Dying on the table can't be worse than being unknown dead, in a short period of time. But they wouldn't agree to it. So he said, the new oncologist, Dr. Mackey, wonderful man, said, let me think. I've got a friend at UAMS. Let me call him and see what he would think. He's a surgeon in that area. So we went up. He called him, got his appointment. We went up there and saw him, and he looked at all the scans and everything. He's like, yeah, I'm not touching this. He said, there's no way I could do this surgery. I think you would die on the table if I did this surgery. He said, I can't do it. Doctor number 5, number 5 that said no. So he said, but I do know a guy, and he had just taken over the abdominal gastric oncology surgery department at UAMS, and he was from Mayo or MD Anderson, somewhere like that. It's where he trained, And he said, we have a big meeting where we have all the surgeons get together. He said, I'm going to take your case to the meeting and share it with all the surgeons. See if anybody has any ideas, or if this man would consider doing the surgery, or someone else maybe consider doing the surgery. He said, great, that sounds wonderful to us. So he does, and they call us back, and he said, I got you an appointment with this guy that I was talking about. He was the only one in that meeting that would attempt it. The only one. So we went and saw him, and had an appointment with him, and he wanted to wait until the next scans for sure and see if the tumor was still not growing, because we just had that one 30-day scan, and at that time it didn't appear to be growing. He said, let's wait, let's see what it is, let's see if it's growing or not growing. And we were just kind of sitting there because we've been told no so many times, and Jeff said, so I'm gonna make this clear. If it grows, you're willing to try to take it out? And he said, yes, I will try to take it out if it grows. And he said, now, you know that you're probably gonna lose your stomach, and I don't know what else I would find when I got in there, but I would be willing to try it. And Jeff said, that's all I want. I just want somebody willing to try it. That's where I'm going to stop, and I'll pick up with part 3 at that point, where we got the doctor that was willing to try to do the surgery. What I want to say to you, and I want to remind you, is that God knows where you are, and he knows what you need, and he knows when you need it. He knew that Jeff was going to need his brother, and he had him on his way. He knew that we needed that doctor. So our doctor retired at just the right time. The other doctor, who wasn't taking new patients, agreed to take us, who knew a guy that knew a guy that knew this guy. Not coincidental. The steps of a righteous man are ordered of God. I believe that with all my heart. Thank you.